Hello, my name is Russ Olmsted with the Targeted Infection Prevention Program study that is sponsored by Dr. Lona Modi and others, and we really appreciate your attention this afternoon as we talk about some general principles about preventing transmission of infection and really advocating for the residents that you take care of at your facilities. We're going to discuss today really the chain of transmission and kind of look at how microbes get transmitted from one patient to the next or between residents, for example, in a long-term care facility. This is module number 2. Obviously, you've heard from Dr. Modi in module number 1 introducing this study. So we're going to spend some time really focusing on the chain of transmission and how microorganisms or germs get moved from one resident to the next, usually on the hands of we as healthcare providers during the care activities involved in long-term care and acute care facilities. So let's take a look at our first slide. This is the model for transmission of infection. It's called the chain of transmission. And as you can see, it has a number of links within that chain. And for there to be actual movement of the microbe and then infection possibly in the next patient or the resident, we have to complete all of these components of this chain of transmission. So this gives you an idea of some principles or concepts to really look at how do microbes move around in healthcare facilities. And in particular, we're going to be focusing on long-term care facilities. So when we look at the first link in this chain of transmission, we're talking about the infectious agent or microbe. And as you can see here, there's a number of bacteria or germs that can be present in the environment in long-term care facilities. And those include certainly bacteria, probably the most common that you might encounter in a resident. And those are various types of gram-positive and gram-negative organisms. There's viruses, such as influenza is a virus that can also be transmitted. Fungi, rickettsia, and protozoa are other types of microorganisms. So I'll be using the term microbe. What I'm really referring to is a germ or a microscopic infectious agent that can cause an infection in a resident or a patient. Another important concept is looking at both endogenous flora and then also exogenous flora. And exogenous flora, for example, would be bacteria that are introduced to a resident from outside their body, so some other source of exposure. And that could be, here's an example that's presented in this slide, looking at methicillin-resistant Staph aureus or MRSA. That would be carried potentially from one resident to another on the hands of healthcare workers if they don't use good hand hygiene. So that would be an example of that, exogenous flora. Endogenous flora would be the type of microbes that you and I all have on our skin and in our bodies. We need those bacteria or germs to really have normal healthy status. So we do have a lot of organisms on our skin and in our body that are kind of part of our makeup. So the microbial flora is what we're really referring to here. Occasionally in long-term care facilities, we do see a change in the type of this endogenous flora. So we can see a lot of residents in long-term care facilities become colonized or actually have the presence of multi-drug resistant organisms such as methicillin-resistant Staph aureus on their skin or in their body. So there's some instances where we see a blending between these two, but a couple of important concepts just to think about in terms of if each of us have our own kind of normal flora, bacterial flora, and that obviously presents a risk for infection when we put in devices into patients, potentially allow bacteria to get into places where we don't want it to be present. So moving on to the next kind of link in this chain of transmission, the reservoir. So we have to have a source where the microbes are actually growing and replicating, or actually growing and kind of reproducing. So when we're talking about reservoirs of infection, certainly in humans we have our own flora that certainly is a reservoir where the organisms are present. And that on our skin, for example, we can have both transient or temporary flora. And then the other reference, not to be confused with residents you take care of, but we have a resident flora, which means microbes that are kind of normal parts of our skin microbial structure. So they stay there all the time in most instances. And they're usually part of the skin, the lower layers of the skin. You'll actually culture these microbes all the time. So transient is things that you can pick up by contact with surfaces, for example. Resident would be kind of your normal endogenous flora, for example, which I referred to in the previous slide. Certainly animals are a reservoir of potential organisms, so if you have a pet therapy program at your long-term care facility, animals certainly could be colonized or have microbes on their for example, and you could pick that up through contact or petting of the animal. So that would be an example of one. And the other thing that I think most of us don't appreciate is the environment around your resident certainly is probably a source or a potential reservoir of microbes, including multi-drug resistant organisms. So things such as MRSA, another multi-drug resistant organism referred to as vancomycin resistant enterococcus, those can survive in the environment usually for some days, even up to several weeks, if they're not removed through good cleaning or disinfection. So the environment around the resident certainly could be a reservoir as well. Obviously, we're looking at trying to minimize contamination in those reservoirs, the environmental surfaces, and then handling of, we're trying to keep clean things clean, soiled things soiled, and we want to keep those two separated. So these are good principles that your infection preventionist at your long-term care facility obviously has already discussed these with you. And then finally, storage, it's important, same principles. Keep clean and sterile supplies separate from areas where you have contamination, such as the soiled holding room, or if you have a bathroom, for example, we don't want to have sterile supplies in the bathroom per se. So that's the reservoir of organisms.